Hello, I'm Senate President Karen Spilka, and I'm here with my assistant Lincoln again. He's healthy and well to send you all a video message for the week of May 18th. Thank you. Today, I hope all of you are aware, the governor announced the start of our state reopening, a 4 phased-in plan, which starts today with construction, manufacturing, and houses of worship. I know many of you have been asking, so this is a big start, a big phase for us. But I do want to stress we must continue to follow proper health guidelines with specific requirements in order to facilitate a safe environment for employees and for the public. Some office spaces will be allowed to open next week, the week of May 25th, along with businesses like hair salons, barbershop, and some businesses will now be able to do remote or curbside delivery service, the retail businesses. According to the plan, in the coming weeks, we'll see more and more of our state reopen with more detailed guidance. I know that I, along with my fellow senators, will be looking very detailed at every aspect of this reopening and examine it very carefully, because when it comes to reopening, it should be done safely and equitably. I'm glad that the initial plan addresses some of the infrastructure that allows people to get to work, some aspects of transportation and childcare, which we must continue to focus on. I believe that families need more concrete guidelines on childcare and potential camp for this coming summer months. I will have more to say on our new normal in the coming days, but in the meantime, I'll be making this plan available on my website, so feel free to go to KarenSpilka.com. That's KarenSpilka.com. I do also want to stress that this is just not a time to let up on any social distancing or the proper health guidance, public health guidance. We've come a far way, and our frontline workers have sacrificed so much. So please, please take care of yourself. Continue to social distance. Wear a mask, wash your hands with soap, and stay home if you feel sick. Those are the basics that will continue to help curb this horrible disease. I do just want to mention that the Senate continues to work on important legislation. We're looking at the reopening plan and where we need to fill in the gaps. This week, it's amazing to realize the Senate would be normally debating our budget. I'd be in Boston and in the State House the entire week. It's a period that I look forward to every year. But we are working on our budget in a different way. I've continued to say unprecedented times require unprecedented solutions. And I know the two chairs of Ways and Means and the Secretary of Administration and Finance are working collaboratively to come up with a process that will benefit all of our residents, our communities, and our businesses. So we will continue to work on that. Last week, we passed a borrowing bill, a short-term borrowing bill, in a historic remote formal session, the first time ever in the history of the Massachusetts legislature. And we are continuing to look at our data collection bill, our diversity task force, and continue to be working on safe voting, early and mail-in balloting. Lastly, I just want to end to remind everybody that May is Mental Health Awareness Month. I have been working in conjunction, and I'm very proud to be doing this. We're working with Secretary of Health and Human Services, Mary Lou Sutters, to release a COVID-19 mental health ad campaign. This is a great public service announcement. It's a what if campaign and addresses the need for each one of us to reach out to our family, to our friends, to our neighbors, to fight a feeling of isolation and loneliness that is such a hard thing to fight during these challenging times. So I've posted the ad on my website. Again, it's KarenSpilka.com. And please continue to take care of yourselves, take care of others, and check in on your loved ones. Till next week, have a safe and healthy week ahead. This is Karen Spilka, Massachusetts Senate President. Please be well.
Right, Link?
Lincoln says goodbye.
Right.